It says so-called whitening toothpaste do not actually whiten the teeth. They simply clean surface plaque off the teeth. Well, here with me now is co-author of that report, Dr Joseph Greenwall-Cohen from the British Dental Bleaching Society. Thanks for coming in.
Thank you.
So what is the problem with these toothpastes?
So there are a couple of problems with the toothpaste. The first is that some of the toothpastes don't contain fluoride, and fluoride is the ingredient of toothpaste which we know has its anti-carcinogenic or anti-caries properties. Also, the fluoride that is in the charcoal is actually deactivated somewhat by the charcoal product. So it's sort of rendered less effective than regular toothpaste.
And why are they not putting fluoride in their toothpaste?
Well, we don't know for certain. Right. I think there are some people do have concerns about fluoride, even though there's no evidence to really substantiate.
That's a long-running issue, isn't it?
Exactly. Yeah. But so I think that may have been the reason. I mean, there are other issues with the toothpaste and its the abrasivity of the product as well.
Well, they're actually taking the enamel off your teeth.
Exactly. So that's what we're concerned of. They're abrading the surface of the teeth, which can weaken the teeth in some regards, and also can increase hypersensitivity too.
And so, so your advice is not to use these toothpastes, is it? I mean, how many people? I don't even know how many people are using these toothpastes.
Sure. Well, my advice for people would be to use a regular toothpaste. We have so much evidence as a profession to prove the efficacy of toothpaste containing fluoride. So if use that, stick to that. It's very effective. If you're concerned about the appearance of the teeth or the colour of the teeth, it's essential. And at the British Dental Bleaching Society, this is something we really encourage, is to meet with your dentist and discuss it, because not all discolorations are simply as a result of drinking too much coffee or tea or wine. They can have genetic causes, they can have medical causes as well. So if you are concerned, it's best to meet with a dentist and have a discussion.
Now, the Dental Bleaching Society, I do need to ask you about that, because is that just kind of one tribe versus the other tribe? That you represent dental bleaching, and it's one lobby, and your people are making money out of that, and that suits you, and so you don't want these other people taking a slice of the market. Is that an unfair analysis?
Well, the British Dental Bleaching Society is a non-profit organisation, and what we aim for encouraging safer tooth whitening, safer bleaching in the UK and in the world as general. We would be over the moon if we had bleaching products which consumers could purchase, which were safe and effective. Unfortunately, there's no evidence to substantiate that they are effective or safe, and until such time that some evidence comes out, which I would love to see, we can't encourage them as a society.
What about the ecological impact? Because of course some people will be using the charcoal toothpaste because they feel it's more ecologically friendly. Your dental bleaching cupboard, is that full of ecologically unfriendly things?
Well, that's a choice which people have to make based on their own preferences and their own ideologies. What we can say is we can't make claims yet on the ecological impacts on charcoal versus regular toothpaste. And quite frankly, I'm not aware of any evidence which does prove that it is more ecologically friendly.
Dr Greenwall-Cohen, thanks for coming in. A bay in